Hey all you cool cats and kittens. This video is on canine morbillivirus, which is more commonly known as canine distemper. So let's make a start. So important to remember that canine morbillivirus is a highly contagious disease. It's characterized by fever, lymphopenia, ocular nasal discharge from the eyes and nostrils, and in some cases neurological complications. As I've just mentioned, this is a highly contagious disease. The contagious period occurs about 7 days after infection and can last up to 3 months after infection. The disease is normally seen in young animals, typically at the age where puppies have lost their maternal antibodies. Disease severity and clinical outcomes is highly dependent on the immune system of the infected animal, as we will see in further detail in the next slide. There is good lifelong immunity after natural infection, but immunity after vaccination is not absolute. The natural hosts of the virus are canids, such as dogs, jackals, wild dogs, etc. Wild felids, such as lions, can also be affected, and large outbreaks in the species have occurred in the past. So the pathogenesis of the virus. The following is a useful diagram to explain the pathogenesis. So if we start at the top left, infection normally occurs through aerosol and droplet transmission. These aerosol droplets attach to epithelial cells of the upper respiratory tract. Virus enters the host and replication occurs in the draining lymph node before systemic spread, where mononuclear cells are infected. This results in the leukopenia and fever seen clinically. Outcome of the disease is very dependent on the response of the immune system. So with a good immune response, there may be mild or inapparent illness. And this is the case for about half of all dogs that are infected. With a poor immune response, clinical signs are seen that are related mainly to the respiratory and gastrointestinal tracts. So these include snotty eyes and nose, coughing, vomiting, and diarrhea. But most of these animals go on to eventually recover. In a small percentage of cases, there may be complications with the virus infecting the brain. This results in clinical signs such as chewing gum fits, ataxia, and myoclonus. Unfortunately, the prognosis, once neurological signs have developed, is very poor, and euthanasia should be considered in these cases. So just to summarize, an adequate immune response clears the infection, and you get persistence of the virus where immunity is not adequate. To reiterate, clinical signs are related mainly to the respiratory and gastrointestinal tract, so signs such as ocular nasal discharge and diarrhea. In addition, skin lesions are also seen commonly. Pustular dermatitis is sometimes evident, as well as hyperkeratosis. Hyperkeratosis of the foot pads, which is also known as hard pad, as well as on the epithelium of the nose. Neurological signs, if they develop, occur a few weeks after infection. The classical sign is these chewing gum fits. Transplacental infection can occur. If the fetuses are not aborted and survive, these puppies can have evidence of enamel hyperplasia on their teeth. Infrequently, skeletal and ocular nasal signs may also be present. As mentioned previously, canine morbillivirus infects white blood cells and causes a lymphopenia. In addition, and with looking at a blood smear under the microscope, you can see viral inclusion bodies. This, however, needs to be differentiated from Hull jelly bodies. Hull jelly bodies are basophilic nuclear remnants that may remain in the red blood cell when the cell is maturing in the bone marrow. So the top picture shows Hull jelly bodies, which are more basophilic than the canine morbillivirus inclusion bodies. Evidence of pneumonia and neurological disease may be seen with diagnostic modalities such as radiology and MRI. So now, the detection of antibodies to distemper in the blood may or may not be useful, depending on the vaccination status of the dog. So if a dog has been vaccinated, it is of little use, as antibodies due to field infection and vaccination cannot be discriminated. What may be useful is to test for antibodies in the cerebrospinal fluid. Vaccination will not result in the presence of antibodies in the CSF. So a positive test on CSF is confirmatory for a field infection. One needs to be very careful, though, of blood contamination of the CSF when collecting the sample, which may result in a false positive result. Immunofluorescence on fresh cells obtained from smears, brushes, and scrapings can also be done. Positive result will show up as an apple green fluorescence under the microscope. So you can see some of those diagrams on the right. Immunohistochemistry is performed on formalin-fixed tissue, and a positive result shows up as a brown coloring on tissue sections. Other diagnostic modalities such as PCR and viral isolation can also be performed. So treatment and control. There's no specific treatment for distemper, so treatment is symptomatic. As mentioned before, once neurological signs develop, the disease will result in death or cause signs that are incompatible with a good quality of life. And euthanasia should be recommended in these cases. The main control for distemper is through the use of vaccination. There's a very good vaccine available, and canine morbillivirus is a component of the routine 5-in-1 vaccine that is used to vaccinate dogs on a regular basis.